Following segment is sponsored by Northern Nevada Health System.
Welcome back to Family 411. We are here at Northern Nevada Medical Center with Traci Biondi. You are the Chief Medical Officer for Prominence Health Plan, and you're here to talk to us about what happens when we leave a hospital, but we still need care at home. Is there a transition program for that?
Yes, a transition of care program. It's a program or a plan for patients when they are at the acute hospital facility and they move from that acute hospital facility to the next level of care, like a skilled facility or to home. And at Prominence Health Plan, we have nurses that are dedicated to this program and this process.
So what types of services and support can a transition care nurse help provide their patients?
Well, a transition of care nurse looks at a patient holistically. They want to understand what their goals are, what are the things that they care about, and then also in the context of potentially a new diagnosis, perhaps the reason why they were admitted to the hospital. And from there, they help to arrange things like whatever they might need outside of the hospital, things like physical therapy, perhaps occupational therapy. They may need help with things like setting up appointments for their primary care, their specialist, and anything that might go along with that.
So it sounds like they're the ones that really work to try to connect the dots for the patients. Is there a lot of coordination between the hospital, the medical team, the transition of care nurse when it comes down to this?
Yeah, there is, and it's not always a straightforward process. Much of the time it can mean coordination between the health plan and the hospital, understanding what needs to happen next. Understanding what the functional status is of that patient, understanding what the mental status is of that particular patient, knowing what kind of support they have available at home as well. Family support, friends or neighbors that are available to help them really be successful at home.
So what does the typical day in the life of a transition of care nurse look like?
Well, our transition of care nurses are assigned to the variety of hospitals in and around Northern Nevada. That means that they go to these hospitals on a daily basis. And one of the things that they do that I think is really, really critical is they visit these patients at the bedside. This really allows them to understand the things that they need, the things that are truly important to them, and even help to explain things to them or provide guidance to the patients and to the families so that they are able to leave the hospital in a way that is truly successful.
Okay, Traci, thank you so much. Great information. And if you want to watch that again, you can find it up on our website, foxreno.com.